Of the many heart diseases affecting the world over, heart attack is one of the most distressing, disabling and life-threatening condition. India has become the capital of heart attacks in the world. Although nearly 30% of deaths from heart attacks across the world happen in India, it is in your control to combat the same. About 1 in 4 people suffering from cardiovascular diseases die of a heart attack in India, and 25% of these people are below the age of 40. That is, the most productive class of population, the younger generation. These numbers are quite alarming, but this can be prevented and controlled if you follow a basic lifestyle or the treatment regime given to you by your doctor if you are a cardiac patient. And to answer all our questions related to heart diseases, today we have with us Dr. Rahul Gupta. He's a leading cardiologist from Navi Mumbai, who's the in charge of cardiology department at the Apollo Hospitals and the director of Cardium Advanced Heart Care Clinic, Vashi. Sir, welcome.
Thank you.
So first and the most basic question, when the patient first time meets you for related to his heart disease, and what are the main symptoms and what are his main complaints? What do the patients tell you?
Okay, so whenever somebody has to suspect whether they are having a heart disease or not, the common symptoms could be breathlessness on walking, they can have chest heaviness on walking, they can have choking in the throat on walking, they can have pain in the arms. So these are the typical symptoms of a heart disease or blockages in the heart, where a person would get symptoms on exertion, because when we are exerting, the heartbeat increases. So when you're running, cycling, jogging or walking fast or climbing stairs, this is the time when the heart is working harder because it's beating faster and it needs more blood for itself. But suppose there are blockages, then they will prevent the blood flow to the heart itself, the heart muscles, and at that time a person would start experiencing these symptoms which I have told you. There are some atypical symptoms also. That means, see, most of us know that when somebody has a blockage in the heart, they would get heaviness in the chest and pain radiating to the arm. But they can also have atypical symptoms like pain in the jaw. So they sometimes land up with dentists. They can have choking in the throat. So they land up with ENT guys. Sometimes they can have pain in the back also. But the most important thing which we all need to remember is that these symptoms will come on exertion. As I told you the mechanism why it would come on exertion. And once they rest, the symptoms should subside because the heartbeat goes down, the demand supply mismatch goes down and they will feel relieved. So anybody having these symptoms, it should just raise their antennas that there could be a heart-related issue. But they should, they should not be worried. They should just consult a doctor before deciding whether it's a heart or not. But these could be symptoms. Other symptoms which are related to weakness of the heart. Some people who have weakness in the heart, they can have heart failure-related symptoms, which are called as, significant breathlessness, the breathlessness increasing on lying down, especially swelling over the feet. So these are the symptoms which can be there. There can be palpitation also, could be a symptom related to heart. But just to tell our viewers that palpitation is something which also comes with anxiety, stress and all, but it could be a symptom related to the heart. So I think if we have to summarize, breathlessness, chest heaviness, choking in the throat, pain in the arms coming on exertion, palpitation, swelling over the feet, these are some symptoms which are common and related to the heart disease.
Right, so the best way is to go and consult a doctor.
Yes, of course, if you get these kind of symptoms, you have to consult the doctor whether they are related to heart or not.
Okay, sir. The second question is, what all information do you seek from the patient after he tells you the symptoms?
Yes, so when the patient is coming to me, I want to know how much is he at risk of developing a heart disease. So what all factors decide the risk is what I want to know, because then I will be able to correlate better. So I would want to know whether he has got high blood pressure, is he taking treatment for high blood pressure, does he have high sugars which is called as diabetes, and is he taking treatment for diabetes, whether it is controlled or not controlled, whether he has a cholesterol problem, whether there is any family history. So all these information tells us that this patient, if suppose somebody has diabetes, blood pressure, strong family history of heart disease, high cholesterol level, if there are addictions like smoking, tobacco chewing, excess alcohol, if they are not exercising at all, they come into a high risk group. Now if a high risk group person is telling me that he is getting chest heaviness on walking, I will be very much concerned and I will be worried that this patient could have a heart disease because he already had that substrate and profile where the heart disease is more common. So these are the information which I am seeking. If they have not known, because most of these risk factors are like silent killers. People have them but they don't know about it because they don't have symptoms. So blood pressure doesn't have symptom of its own. People think that if I have a blood pressure I would have headache, but most of the time people don't have any kind of symptoms. High sugar doesn't have any symptoms unless it becomes very high and has caused complications. Similarly, high cholesterol doesn't have symptoms. Smoking, it gives a kick, so it doesn't have symptoms. Physical inactivity doesn't have a symptoms, but they are causing the damage to the body. Okay, so I want to know these information. If they don't know their history, prior history, they have never got it checked, then I would usually do these investigations to find out if they have one, and then I would advise further tests to know whether their symptoms are really related to the heart or not. The symptoms which the investigations which are very easy to do on the OPD basis in few minutes time is ECG, which takes about 2-3 minutes. Then 2D echocardiography, which tells us about how the heart is functioning. Heart is got, it's a muscular chamber, it has got a pumping function, it has got a layer which surrounds the heart, pericardium, it has got valves, there are 4 valves in the heart. So once you do an echocardiography, it is like peeking inside the heart, it is like sonography of the heart, and you come to know whether how is the heart structure, how is the function of the valves. And then there is another test called a stress test. So stress test is, we want to make our patients run on the treadmill, because we are now trying to stress the heart by making it run, because once they are running on the treadmill, their heartbeat is going to increase. Once their heartbeat is going to increase, if there is a blockage in the heart, then there would be a demand supply mismatch, as I explained you in the earlier question. And this demand supply mismatch will cause them symptoms as well as ECG changes on the treadmill test, because you are monitoring the ECG during the exercise. So this is how these some information which I want to know from my patients, and then we try to correlate all their symptoms, whether they come on exertion, they come on the rest. So if some patient is saying that I get pain at rest, it has nothing to do with exertion. That means when they exert, it doesn't change, or it remains same, or it is not related to it, it is unlikely to be because of the heart.
Okay.
Because heart symptoms would come on exertion, as I explained to you. So all these valuable information, I am taking it from the patient history, as well as their past history, their family history, their investigations, if it has been done. If they are not done, then we advise those investigations, and based on all these information, once we have all these information, we can rule in or rule out the heart disease, and then we can decide further whether they are going to require medications, or they can be just they need further more investigations. So all this information helps us to get.
Okay. Sir, there's one myth that we all have heard of, that anybody who suffers from any heart disease, he or she has to go through a surgery. How true is this?
Okay, I think this is completely untrue. There's a general perception that if we go for some test to the doctor, to the cardiologist, then if the test shows some abnormality, only some kind of surgery like angioplasty or open heart surgery would be suggested. So it's completely myth. To tell you the fact that most of the blockages can actually be treated with medications, and medications can do wonders because the medicines have advanced significantly. But we have to differentiate. In each and every patient, we have to differentiate whether they are stable or unstable. So when the patient is stable and they have got stable angina, that means the patient doesn't have symptoms at rest, they can do their normal activities without any discomfort. Only when they get, when they do more activities and more than usual activities, and if they are getting symptoms and the symptoms get immediately recovered once they rest, these are called as stable symptoms. So even if they have severe blockages but they have stable symptoms, they can actually be managed with medications alone. And there are certain non-invasive technologies also which I practice quite often, and which I suggest to my patients that it can actually help them to take care of their heart disease. Now, second part is when the patient is unstable. So when the patient is unstable, that means even on little activity he is getting discomfort in the chest, he is perspiring, he is getting a lot of heaviness in the chest, even at rest he is getting, after eating food he is getting heaviness in the chest. So these are all unstable symptoms. Or somebody undergoing having an ongoing heart attack. These are examples of unstable situations. So in these kind of situations, it is always suggested that they undergo some kind of procedures like either an angioplasty or bypass if the blockages are critical. Or sometimes we try medications in these patients, and if they convert from unstable to stable state, we can manage them into with medical management. But of course, if somebody is unstable, the better choice is to get themselves treated without any kind of fear. So just to add on, with the advancement of technologies, Now even the most complex cases can be dealt with very precisely with a lot of safety, because there are latest equipments which have come. For example, the place in Apollo where I am practicing in Navi Mumbai, we have the best of the equipments, the latest technologies like OCT, which can take the camera inside, very miniaturized camera, and you can actually do a precision angioplasty, micromillimeter precision angioplasty, because you can see everything inside with 3D configuration with extreme clarity, so that things are becoming much easier. Calcium can be broken with rotablator. Then there is a technology which can tell us whether this block actually needs angioplasty or can be managed with medication. Sometimes the block looks severe, but actually it can be physiologically not affecting the heart significantly.
Okay.
That means it is not causing the serious impact on the heart. These kind of blockages again can be managed medically. So the answer that every patient requires any kind of surgery like angioplasty or bypass is a big no. Most of the patients can be managed with medications. You have to select the patient. There are criteria for selecting whether they are stable, unstable. So we have to go through that process, and we can be actually be safe even without these procedures.
So basically it depends on the situation.
It depends upon the
stability
situation, stability of the patient, patient's choices, and then there are non-invasive technologies also which we practice and offer to all the patients who come to us.
Because people usually are really scared if somebody tells them that you'll have to go through a surgery.
Yeah, see, I would say that if somebody has really got some kind of critical illness, rather than suffering a major complications which causes sometimes irreversible damage to the heart, not able to recover then, and leading a miserable life with poor quality of life, it is better that if there are indications. So if you are worried, I tell people that if you are worried and if you want to take second opinion, third opinion, don't hesitate. And most of the doctors, if you politely ask them that I would want to take some time, I would want to discuss with somebody else, I think it is open. I am very open. I actually in fact suggest all my patients that whenever I am advising them something, they should feel free to take advices. Only situation where I tell them that you should not run around and waste your time is an ongoing major heart attack, because if you are wasting the time in that precious time, it is you're losing the heart muscles, which is not good.
True.
I hope this answers what
Yeah,
you
it
wanted
did.
to.
The myth burst over here. Thank you so much, sir, for answering all the questions. I'm sure it is going to help a lot of people. And we'll be back again with a new video on a different topic. Do watch.